Hello everyone, welcome to our YouTube channel Pharma Explorer. Today we are understand or study the topic gastrointestinal system and the drug of choice. Drug of choice ये जो topic है, it's very important to according to your pharmacist exam, entrance exam, competitive exam, and as a pharmacist, as a knowledge perspective, it's very beneficial to everyone. Okay, so without delay we start the session. Gastrointestinal system, drug of choice of GERD. Okay, that is proton pump inhibitors. Example, omeprazole. Okay, then drug of choice for duodenal ulcer, proton pump inhibitor. Drug of choice for stress ulcer, cimetidine, histamine H2 receptor antagonist. Then dyspnea, that is also drug of choice is proton pump inhibitor. Drug of choice was erosive esophagitis, that is a proton pump inhibitor, means PPI. Then duodenal ulcer, I think that is repeated. Okay, we can continue with next drug of choice. Then drug of choice for Ellison syndrome, Zollinger-Ellison syndrome, that is PPI. Drug of choice for morning sickness, prochlorperazine D2 receptor antagonist. You know, morning sickness is the symptoms for the pregnant lady, and then we give the medication with the chlorperazine, that is D2 receptor antagonist. That next is drug of choice for NSAID induced ulcer, means non-steroidal anti-inflammatory drug, that is PPI. Then that is also repeated. That drug of choice for post-operative vomiting, that is aldosterone 5-HT3 receptor antagonist. Okay, for antiemetic drug. Then vomiting induced by cancer, chemotherapy, aldosterone. Once again, drug of choice radiation inducing vomiting, that is also aldosterone. Then vomiting due to radiation is also drug of choice aldosterone. Then drug of choice for NSAID induced gastric ulcer, that is a PPI. Then peptic ulcer, omeprazole. Drug of choice for vomiting patients of Parkinson disease, domperidone, that is a selective dopamine D2 receptor antagonist. Antiemetic drug of choice, metoclopramide or prochlorperazine and metoclopramide, that is antiemetic. Okay, then drug of choice children in constipation, castor oil. Then cleaning bowel before delivery, sodium phosphate enema. Then drug of choice for cleaning bowel for endobiopsy, polyethylene glycol. Drug of choice for constipation in chronic renal failure, aluminum hydroxide. Then functional constipation, dietary fibers. Drug of choice bedridden patient with constipation, phenylephthaline. Okay, contact laxatives. Then stool softening, dialkyl sodium sulfosuccinate, irritable bowel syndrome, gastroid 5-HTH and agonist. Then increasing motility, mosapride, gastro prokinetic. Then diabetic gastroparesis, musapride. Then drug of choice for spasmodic abdominal pain, drotaverine, phosphodigester inhibitor. Then pain relief in ulcer, antacids. Diabetic diarrhea, clonidine. Infectious, non-infectious diarrhea, drug of choice is loperamide. Then drug of choice for secretory diarrhea, chlorhistamine. Then next is carcinoid syndrome, cyproheptadine. Then drug induced vomiting. Okay, I'm sorry, it's for respiratory. Then क्या देख रहे थे हम, इंड्यूसिंग वोमिटिंग, एपोमोफ्राइन. देन ड्रग ऑफ चॉइस फॉर शॉर्टनिंग गैस्ट्रिक एम्प्टी, टाइम बिफोर सर्जरी, metoclopramide. Then drug of choice for shortening gastric emptying time before surgery, that is metoclopramide. Then Mendelssohn syndrome, metoclopramide. Vomiting in children, metoclopramide. Inducing for vomiting, not for anti-vomitic, that is inducing vomiting, ipecacuina. Then drug of choice for laxative effect with hepatic encephalopathy, there is a lactulase. Okay, we all cover the drugs for the GIT system. Okay, next is respiratory system. Okay, drug of choice for COPD, that is anticholinergics, tiotropium. Then first line drugs for tuberculosis, rifampicin, isoniazid, pyrazinamide, ethambutol, streptomycin. Then drug of choice for testing, bronchial hyperactivity, methaqualone, non-selective muscarinic receptor antagonist. Drug of choice for pulmonary edema, congestive heart failure, CHF, furosemide, that is a diuretic. Then drug of choice for a vasodilatory shock, norepinephrine. Drug of choice for pararesistant hiccups, that is CO2. Then drug of choice for apnea in premature infants, theophylline. Drug of choice for exercise induced asthma, that is mast cell stabilizer, sodium chromoglycolate. Drug of choice for aspirin induced asthma, leukotriene antagonist, that is mutolacast. Then starting treatment of asthma, inhaled beta 2 agonist. Drug of choice bronchospasm with COPD, that is ipratropium bromide. Drug of choice for smoking cessation, that is nicotine. Drug of choice for liquefying palax of sputum in patients with cystic fibrosis, acetylcysteine. Then drug of choice for temporal arthritis, that is corticosteroid. Then prophylactic exercise induced asthma, sodium chromoglycolate. Then pulmonary edema, furosemide. Drug of choice for dry itchy cough, codeine. Then asthma attack, salbutamol. Okay, then drug of choice for persistent asthma, inhaled corticosteroid. You can write down also. Okay, then okay, one more slide for the respiratory drugs. Okay, then we study drug of choice for asthmatic patients with hypertension is amlodipine. Drug of choice for pneumocytosis crania, that is a cotrimazole. Then drug of choice for suppression of cough, dextromethorphan. Then drug of choice for ACE inhibitor induced cough means acetylcholine, that is aspirin. Asthma diabetes, ipratropium. Then beta blocker induced bronchospasm, ipratropium bromide. Then choice of for mild intermittent inhaled beta 2 agonist. Drug of choice for mild persistent inhaled low dose of corticosteroid or mast cell stabilizer or leukotriene antagonist. Drug of choice for moderate persistent inhaled corticosteroid with long acting beta 2 agonist. Drug of choice for persistent asthma, high dose inhaled corticosteroid with long acting beta 2 agonist and oral corticosteroid. Okay, then oral corticosteroid. Okay, poorly controlled asthma, theophylline. Drug of choice for prophylaxis of asthma, sodium chromoglycolate, then mast stabilizer. Okay, today we cover the two system drug of choice, respiratory and gastrointestinal, GIT. Okay, so you can write down also or to get a screenshot also and repeatedly read it or listen the video, then you get by heart all the drug of choice of product, drug of choice of system. Okay, so please like the video and subscribe. Thank you.